Hey guys, it's Dr. Salcedo, your conscious gynecologist. I'm so glad you're here, and thank you for joining to this for the second session of conscious motherhood. Remember, these short video classes are going to help women understand their cardiovascular disease risk, but also their reproductive risk as to why certain pregnancy complications happen the way they do. So, we're going to get into a little bit of nitty-gritty here. It's going to be a little bit of a higher level class. But since you got through the last class and you're ready for this class, we're going to talk about healthy living and healthy lifestyles, and not in the way that one would normally notice. In a lot of my videos, we talk about insulin resistance and stuff, and that's just one piece of the puzzle. We're going to talk about a few other things too here. We're going to talk about healthy lifestyle and as it relates to womanhood. Now, in this conscious motherhood class was a class of series of 4 classes that I did when I was working at a clinic that was looking to reduce a woman's risk for future pregnancy complications, but also high blood pressure, diabetes, and stroke risk in the future, because we know that women who had certain pregnancy complications like diabetes, hypertension, growth restriction, placental problems, preterm delivery are at inherently increased risk for diabetes, hypertension, stroke, heart attack in the future. And so we created this class in order to help reduce those risks, but also thereby reducing further pregnancy complication risk in the future. So this is part 2 of that class. Dr. Alale Mapar was one of my resident doctors who was helping me with this class, and she created these series of slides that I've modified somewhat. So thank you, Dr. Mapar. I'm going to be using some of the basis of her slides and expanding on it a little further as we talk about healthy lifestyle as it relates to womanhood. Now, you've seen this circle, you've seen this inflammation and high insulin circle and all of the different causes. Here in this class, we're going to talk about poor sleep, lack of physical activity, chronic stress, and trauma, because these are really serious concerns that are often underlying. Like, we don't really talk to our doctor about that. Maybe we're not sleeping well on a day-to-day basis, or maybe that we're not doing muscle building exercises on a day-to-day basis. Actually, some stuff in this circle that actually causes a little bit of shame to bring up to our doctor, because it shows that we're like a real person and that sometimes we're struggling. And I don't know, I think in this day of social media, we're always trying to project this image of like, I'm doing well, I'm doing fine, but I don't really know why all this stuff is happening. Well, I really want to hear about it, and I really want to talk to women about it and share, because I have my own struggles with difficulty sleeping or difficulty getting to the gym. And so I want to be able to normalize those things, but chronically, just like the paper cut idea where we have these chronic paper cuts every day we're getting the same insult to our body. We're just not healing. And over time, these are what causes problems in pregnancy. These are what causes poor metabolic health. It's not like when you get like a pneumonia and you get your antibiotic, or your bladder infection, you get your antibiotic. That's really great solution to treating the problem. But remember, chronic disease and pregnancy complications come from chronic problems, little tiny microinflammations that lead to major things. So that's what we're going to get into here. So the first thing I want to talk about is actually, how do we improve our lifestyle with attainable goals? So many of you may have heard of this acronym called SMART goals, which is specific, measurable, attainable, relevant, and time bound. It's a way of actually putting our ideas, our goals on paper to create attainable, life-changing habits for the future. Because if we don't set ourselves up for success, then none of these lifestyle changes are really going to make a difference. And so, S for SMART, S. What exactly are you trying to achieve? What specific goal are you trying to achieve? Are you trying to get better sleep? M, measure. How are we going to measure this? How will you know when you've achieved it? Will that you be able to like feel rested in the morning when you wake up? A, attainable. Is this something that we can actually attain? Is the goal too lofty? Like, are you trying to say that for 30 days a month, you're going to get 7 to 8 hours of sleep a night with a couple of young kids in the house? Now, that might not be attainable because sometimes they come into your room and like disrupt your sleep, or you've got like a child who might be sick and you're waking up. But by and large, is this something practical and attainable that you can fix? Are relevant. Now, is the goal relevant to your life? Now, let's say that you are having trouble sleeping. Maybe, like, for example, in my situation, I really do struggle with some insomnia, and that has a lot to do with sometimes I just do too much. And because I'm doing too much, my mind just can't stop thinking about planning, and that makes it really difficult for me to sleep. And so that's where then I start to feel sluggish through the day, and it makes it more difficult for me to kind of get through the tasks and be a good mom and be a good doctor because sometimes I'm sleepy or tired. And so this stuff is has to be relevant and it has to impact our life in a negative way that we decide, no, I'm not going to deal with this anymore. I'm going to try to create solutions. So that's where the relevancy piece comes. And then T for time. It's time bound. When do you want to attain this goal? And so that's what I'm going to use as a basis for the rest of this talk is a SMART goal. What are you trying to achieve? How will you know when you've achieved it? Is it possible to achieve it? Does it contribute to your relevancy in your life? And when will you do this? So sleep. We've talked about sleep, and I've actually shared my own struggles with sleep. In the comments, tell me about what it is that you're struggling with. What is your inflammatory risk factor? Now, for me, I know that I'm low carb ketovore diet person, but that's not the only inflammatory factor because I'm sometimes struggling with sleep or other factors on that circle. Those are also things that continue to contribute and ongoing. And like when I talk to patients in the clinic and they're like, Dr. Salcedo, I'm fasting, I'm, doing zero carbs, like, excuse me, I don't understand why I'm not losing weight because there's also other things in that inflammatory circle that we need to address. Sleep is definitely one of them. So, how much sleep do we really need? Well, the Institute of Medicine says that we should be at, in adulthood, somewhere between 7 to 9 hours of sleep, with 10 being the upper limit of normal and the 6 being the lower limit of normal. Because the reason why we need sleep is really to allow our body to have restoration, to utilize our tissue turnover and repair, for our immune system to process, for our digestion to occur. That's why a lot of people in the morning, when they get up in the morning, within an hour or two, they have to have a bowel movement because their body has been digesting all night. And so sleep is really reparative and restorative. We really do need to get good rest. Now, if we don't get that much sleep, then we're already deficient in our reparative processes. So why is it important? And like, what does it have to do with like the room that we're sleeping in and the distractions that might be surrounding us? Well, when we are in the day, light actually activates a certain area called the suprachiasmatic nucleus in our hypothalamus, and that causes serotonin to be produced, causing us to feel energized. So like sometimes like if you're in a long class, you maybe in this class in a dark room or at work with no windows, you got to go outside to feel energized. And I do that frequently. I sometimes when I'm in clinic and then I have a lunch break, I'll go outside and take my sheet outside and I'll lay in the grass and invite a few colleagues to come and have lunch with me outside when the weather is good so that we can get some vitamin D. And I feel really energized. But on the flip side of that, when there's darkness at night, that helps also activate our suprachiasmatic nucleus to produce melatonin, and that causes us to feel sleepy. Now, the flips can happen whether or not like our room is dark. So like if we're in a room at night to sleep and then there happens to be some ambient lighting that's nearby, maybe like our clock or the phone or something, or maybe even a street light outside that's causing that light to affect us and make it more difficult to create melatonin, then I would highly recommend like putting shutters or blackout curtains, or even like putting tape over your clock radio at night. It's just so that you can reduce some of those lights that cause your body to feel more awake. I sleep with a sleep mask, and that works tremendously. It puts me right to sleep. And that's because it creates that dark area that I need in order for my SCN nucleus to produce melatonin to help me sleep. Now, what is the impact of poor sleep? When they've done studies that look at women and men who have struggles with sleep, and when they remove all the confounders, so were they obese? Were they diabetic? Did they have hypertension? All of those confounders that were removed, when you remove those confounders, the lack of sleep increases the risk for all these cardiovascular disease problems. Hormone imbalances are one of them. Remember, your body's constantly scanning to see, your brain is constantly scanning to see if you're safe enough to have a baby, if life is healthy enough and stable enough. And as soon as it starts to feel that there is instability, your brain, your reptilian brain, is going to protect you from having a baby at a time that's not right. And so a lot of women, as you know, people who have struggled with infertility, and then they go away on a nice weekend or vacation with their partner, and then they become pregnant after years of infertility. It's that feeling of safety and finally getting some sleep that really does help activate our hormones. And so, yes, and that also has to do with chronic pain. With people who don't get that restoration of sleep, they have a lot more pain as well. So let's get into the nitty-gritty. When you don't have that much sleep, it changes your neuroendocrine system, your autonomic fight or flight nervous system, your cortisol system, and then your inflammatory mediators. All of these things together can cause associations with obesity, but as well as insulin resistance. And then those two, one may be impacting the other, that can lead to type 2 type diabetes. And so sleep loss is tremendously important because it affects our appetite and can increase our risk for obesity. It affects our flight nervous system, and it raises stress hormones, glucose and catecholamines, and that leads to insulin resistance because we need more insulin to keep normal glycemia. And then it increases inflammation because our body feels like it's under stress. And these are inflammatory cytokines that are molecules that are present to try to help repair things. But when there's too much of it, it actually causes damage to our blood vessels. So let's look at this circle, and we can kind of see a practical example of that last slide. So if we're feeling tired and hungry because we didn't get to sleep very well, then we eat food, which our food causes the secretion of insulin. And if we have too much insulin already present, then our cells resist insulin because that connection between the insulin receptor and the insulin molecule doesn't actually create a good bound or binding um, relationship, and then it doesn't activate the processes as it normally should, and it causes sugar to be stored as fat. And then it goes around and around and around. And so this cycle is really hard to break unless we restore our body with some really great sleep. So, what are some tips for some healthier sleep routines? Well, create a schedule with the same time. And so, oftentimes, like, and I'm definitely someone who can admit to this, that on the weekends I tend to sleep in. But if I sleep in too much, then it kind of messes up my ability to go to bed at a normal time. And then I stay up later, and then I can't go to sleep on Sunday night. And then it's just really hard. And then that cycle just continues. And so, it's really important to create like a very routine base of when you're going to wake up and go to sleep, but also to unplug from any kind of distractions like any screens, because that light can activate our SCN nucleus to increase more serotonin to keep us more awake. And so, and that really makes it more difficult to sleep. Like sometimes when you're working on a project and stuff, and then you're on the computer, and then it's difficult to go to sleep after that because when it's finally time, like then your body's still so awake, it's hard to kind of reduce that serotonin so quickly. Also, practicing relaxation before you go to bed. So doing a yoga routine. There's so many online, breathing exercises. Those kinds of things help reduce the fight or flight response that cause alertness. Now, remember your bedroom environment, keep a cooler bedroom because a cooler bedroom helps people sleep a little bit better. Earplugs, some white noise, a sleep mask, removing electronics from the bedroom. And then daily healthy habits of like physical activity. Just try not to do that stuff right before you go to bed because then that activates like your serotonin and your happy juice in your brain, and that makes it more difficult to sleep. But avoiding large meals, caffeine, alcohol. I mean, a lot of people think that they drink alcohol makes them sleepy, but for those first few hours after you drink it, actually causes an alertness, and you really want to avoid that stuff. And then just get daily sunlight exposure if you can, especially in the morning. But if you can't, then definitely look into some like UV lights to help with your alertness and vitamin D in the day. Now, so what is the goal? How are we going to improve based on what we've learned here? What's the SMART goal? So, an example could be I will get 8 hours of sleep at least 5 days this week. Or I will cut down on my screen time before bed by shutting electronics off for 30 minutes before bed this week. Now, remember, make your goal. Go ahead and write down your goal based on what you've learned so far in terms of sleep in order to improve that quality. Physical activity. This is another one that I also struggle with because I I like going to the gym to work out, but getting me there is really hard. And like sometimes I feel like it's not the most natural thing to do, like I just sometimes in my brain I can't think of like why the cavemen needed to go to 24-hour fitness like to get feel better. But I have to remember that where we live and modern lifestyle doesn't lend to a lot of the physical activities that we used to do. Even, 60, 70, 80 years ago, when there were homesteaders and, people who were living off the land and they were doing a lot of activities that were increasing their muscle mass. And really, my modern lifestyle just doesn't lend for that. And so I'm really trying to work on this too. So, what is the best exercise? Well, the best exercise is the one that you like to do and that will actually cause some sustainability. So, I'm really regimen and rubric based. Like, I love following a plan. And so, my gym recently has like an app that gives me some exercises to do. So, I don't kind of like just go and fumble around with like exercise equipment and not knowing what I'm doing. And it also feels like I'm wasting my time. And so, if you have a regimen that you can stick to, that really helps. There's all kinds of different recommendations for like how many hours a week and how you should get your heart rate up and all that stuff. And I really do feel like a lot of times those recommendations set people up for failure because oftentimes it's really unattainable or unsustainable. And people look at physical exercise as like a way to lose weight. And we already know that the calories in, calories out model just isn't something that we can apply to our body because we're not machines. We're a complex hormone mechanism, and that's how we reduce weight and gain weight and how our body functions. And so, this endocrinologic system, you can apply exercise to lose weight in that way, but you can apply exercise to raise your heart rate to cause good cardiovascular health, to keep your heart rate up and have your heart pump well. And that can be by raising your heart rate in an exercise to 110 to 120 beats per minute, approximately for about 15 minutes. And that will really give your heart a great workout. But anything also that causes muscle building, so strength training, using bands, lifting weights, those wonderful bands that in a those like resistance bands because resistance training has been very helpful at building muscle mass. And like, why do you need to build muscle? Well, because it's an excellent storage for glycogen, which is like the glucose storage of your body. And so it actually helps give it a depot for your body to deposit more and more sugar so that you can keep normal glycemia. It's a hormone. Your muscle is actually like one of the like most underrated like organs that help with our hormone response. So there's all kinds of different recommendations for levels of intensity, but When we think about vigorous activity, that's kind of like when you're almost a little uncomfortable doing your exercise. This is for me like running. I don't really like running because it actually kind of activates my endometriosis symptoms. It kind of will give me a little diarrhea actually. And so this running is for me is vigorous activity. It's kind of borderline uncomfortable, but I can still speak a sentence, but even kind of starts to get very hard. Moderate activities where you're breathing hard and you can hold a short conversation and it's still a little uncomfortable, but not as bad as the level 7 to 8. Now, if we look at moderate intensity aerobic exercises, that is like tennis, doubles tennis, or walking fast, dancing, water aerobics, swimming, running, gardening, riding a bike with light effort. These are moderate intensity exercises that can bring us to a really high heart rate. But I wouldn't say go to your max because then that's when you start to increase your lactic acid and you get really sore muscles and start to feel really kind of tired and dizzy. Vigorous activity would be like jumping rope or singles tennis, riding a bike up the hill, maybe long running, swimming laps. These are really, really high intensity workouts that for some people over long periods of time training will help get you to these levels, if you like it. Now, the whole point is like to keep your heart rate at a steady heart rate around 110 to 120, and that will allow you to continue to speak. And then eventually, as you go through time, you'll be able to sustain more vigorous activity with a lower heart rate because your heart is pumping well. So, in terms of a SMART goal for exercise and physical activity, what is the SMART goal that you're doing? So, for an example, I will take a brisk walk for 30 minutes 5 times a week. Okay. And so that is it's a goal that addresses the frequency, the intensity, the time, and how long and what type of exercise are you doing to make your goal attainable? Stress. Ah, this is a good one. And stress can be so many things for so many people. Sometimes it could be financial stress or relationship stress or the a deadline coming up, a final examination coming up. Um, excuse me. There's so many different stressors out there that can affect us, and there can be good stressors and bad stressors. And let's talk about how they affect us. Now, there are two types of stress. Eustress, which is the form of stress that actually has a little bit of a benefit to our health. It is maybe the stress that I was feeling getting ready for this lecture because I want to teach women about how certain stressors can affect their body. And that even gave me a tiny bit of stress, but it was useful because it gave me motivation to help women. Now, distress is a type of stress that has negative implications, and it's kind of like what we normally think of as the word stress, a negative stress. And so it could be a loss of a family member, a divorce, alcoholism. It could be like a move, a change in sleep patterns. It could be environmental stress, kind of like if it's too hot or humid, or if there's too much lighting around us, like overstimulation that happens to our brain and we have to walk out and go to a quiet area. It could be the loss of a job or a change of a job, or maybe working under pressure, working with a toxic person. It could be night shift work. And even though people have done night shift work for many years, we know that that is highly associated with cardiovascular disease. And all of these stressors activate our immune system and it makes our immune system ready to fight or flight. It makes our immune system ready to repair any mechanisms that could be there. But the presence of these active cytokines, these immune modulators, can actually be damaging to our immune system, to our blood vessels, to our organs because of their mere presence that causes inflammation and tissue damage. And so that can lead to a lot of the pregnancy complications at the microvascular level that we talked about. But examples of short-term stressors that are actually pretty beneficial would be like marriage, if it's a positive one, pregnancy and childbirth, or an outstanding achievement, a job promotion, when your child gets older and leaves home, or winning the lottery. Those kinds of things can be use stressors that can help us in a positive way. But for some people, they actually can cause distress too. So it just depends on what your triggers are. So if we look at this diagram, it talks about how the level of stress and what that does to our motivation and our behavior. So if we are under too little stress, it actually causes boredom and confusion and apathy, and we're not really paying attention. This can be a source of negative stress as well, a distress. Positive stressors are everything that we talked about. It gives us really good emotional balance and goal setting. And a distress would be things that are like maybe you're at a party and you're overstimulated, or at a function, or if you're burned out at work, or if you're maybe drinking too much, and all that causes a lot of brain dysregulation, and that could be too much stress. So it's thinking about where your activities are and how your body's responding based on this slide. So, but it's really important to realize when stress can actually create trauma. And trauma is really important to recognize because the traumatic events unfortunately happen and they're part of our evolutionary biology. But the thing about trauma is that it's important when we do have a traumatic experience, like when we were cavemen, right? Like we would get like hunted by a bear, or there was like a some sort of physical threat to us. What would happen is our sympathetic nervous system would activate, and the fight or flight system takes over. So our body gets flooded with adrenaline and catecholamines, epinephrine, in order to help increase our heart rate. It flood our system with glucose to go to our muscles to fight or flight the bear or run, right? But if we cannot, because we are held down by someone in a traumatic experience, maybe we're being sexually assaulted, or if we're in a car accident and we can't get out of the car because we're trapped, or because we're in maybe an abusive relationship and we can't leave the home for long periods of time, or we're little and we saw our family members beat each other up and we were too little to run away. All of these things don't allow the discharge of the catecholamine, the discharge of the epinephrine, and then our glucose is elevated for that event that may never come. And so that's why the main treatment for trauma is actually movement therapies like EMDR and yoga and brain mappings, so in order to discharge that catecholamine, that stress hormone release, so that it'll bring our glucose level down finally. But if we can't discharge it because we never were in the position to run away during those traumatic events or use our muscles, then our glucose levels chronically elevated, our insulin levels chronically elevated, our stress hormones are chronically elevated, and we are way more under a stress that increases our risk for cardiovascular disease because of our inability to discharge it. So trauma is really important. The actual event is not as important as your ability to discharge it when it was time. But if you can't, there are excellent therapies out there that will help you do that. So, stress's impact on health is huge. We know that it can cause weight gain, it can affect our immune system, it can make it more difficult to sleep, it affects our gut health. And so, this is really of particular importance because so many of my patients who have endometriosis have experienced some sort of traumatic experience in their life that affects their gut. Now, remember, your gut has the same amount, if not more, neurons than your brain does. And then that's actually the highest place where there's serotonin receptors, which are the happy receptors. And so that phenomenon of like I have a gut feeling about something is real because our gut is constantly sensing with the assistance of our brain of whether we're safe or not. And so it's a huge impact on our health. And it does, if we have chronic stress, that will disrupt our gut microbiome and lead to a lot of these chronic disorders that we're experiencing too, as well as like fibromyalgia and heart problems and memory problems and diabetes. So all of these things are really, really important to recognize, as stress can affect our metabolic health. So how do we manage this? Well, stress is like, we've talked about all the different sources of stress. And so now how do we manage it? Well, sometimes there's a lot of great data that shows that meditation is a really wonderful way to help reduce the brain activity that helps us keep our mindfulness and our anxiety under really low levels. There's all kinds of apps that help with this, breathing exercises and mindfulness exercises like Tai Chi and yoga, expressive movement therapy, like we talked about, to discharge that anxiety, the discharge that's catecholamines. And so for me, I know when I'm getting more anxious, like I need to do a yoga or a cardiovascular workouts just so I can get my heart rate and discharge those feelings. Therapy is incredibly helpful. And so if you're dealing with any sort of this dysregulation, I highly recommend a trained therapist to help guide you through this. A wonderful therapist who's trained in acceptance and commitment theory is really helpful. That's a type of therapy that's a little different from cognitive-based therapy, and it's very good at looking at mindfulness-based strategies in order to keep us stable. Volunteering, doing something that helps us feel better, and participating in some sort of religious experience or a spiritual experience can really help bring our stress hormones down. So there's all kinds of different breathing exercises that can help bring your stress hormones down, activate your rest and relaxation part of your nervous system, your parasympathetic nervous system. And so there's like 4-finger breathing. So breathing in for 4 seconds, holding it for 4 seconds, breathing out for 4 seconds, and then holding it for 4 seconds. These are incredible exercises that will help us with activating that sympathetic nervous system. I do this all the time, maybe in between patients and in between morning and afternoon clinic. When my kids are, we're a little more rambunctious than normal. I do this all the time to try to help activate my rest and relaxation nervous system. It's a tool that you can use. I bring my patients through this all the time. And go ahead and check out the ways and how to do this. So when we bring it back to our SMART goal, we can think about how are we going to use what we've learned to decrease that stress in our life. So it could be that, all right, maybe I do feel like meditation has a role to help me with my stress. Then maybe for the next month, I will meditate for 10 minutes every morning to reduce my stress. And by doing so, I'll use the 5-finger breathing exercise in the last slide. That's a really great attainable goal. Go ahead and give yourself a moment to create a goal based on how you can reduce your stress now. Now, the next session is going to be on addiction, and it's going to be on how addiction plays a role in chronic disease, particularly carbohydrate addiction. And I'm so excited to bring you there. Thank you for staying till the end of this session 2 Conscious Motherhood Lifestyle session.